Good morning. My name is Keith Stewart. I'm a hematologist at Mayo Clinic in Arizona. And tomorrow afternoon we will present the results of the ASPIRE phase 3 clinical trial, which compares the irreversible epoxy ketone proteasome inhibitor Carfilzomib, a novel targeted therapy, with the reference treatment Lenalidomide Dexamethasone. This was a large study. It was conducted in 90 centres in 20 countries around the world and accrued 792 patients. The two arms of the trial are shown here. The reference treatment is Revlimid and low-dose dexamethasone weekly. The experimental treatment is the same combination of drugs with the addition of Kyprolis. Kyprolis is given in the same schedule for 1 year, following which the frequency of dosing was reduced, and I think importantly, after 18 months, was discontinued. The primary endpoint of the study was the duration of time that patients were free of disease, or progression-free survival. This was highly positive in favor of the combination therapy arm. The median progression-free survival for Kyprolis with Revlimid and dexamethasone is unprecedented in first relapse myeloma at over 2 years, 26.3 months, versus the control arm, which did exceptionally well as well at 17.6 months. This is a difference of 8.7 months. The hazard ratio is 0.69. And you will note that the maximum separation of the curves is at 18 months, at which point the Carfilzomib was discontinued as pre-planned by the study. The second, one of the secondary objectives and the second important take-home message from this study is the overall response rate was also significantly higher for the triplet combination than for the doublet. 87 versus 67%. And even more impressively, I think the complete response rate was more than 3 times higher for the patients who took 3 drugs instead of 2 drugs. At this time, the median overall survival for both arms of the trial has not been met and did not cross the pre-specified boundary set by the statisticians when the trial started. However, there is a trend in favor of the triplet Kyprolis-containing combination with a hazard ratio of 0.79 and a p-value of 0.018. At 2 years, the Kaplan-Meier overall survival is also trending in favor of the triplet combination. We'll talk about side effects just briefly. This is actually another, I think, very encouraging aspect of the results we will report, which is that despite adding a third drug to the cocktail of treatment that the patients were undergoing, adverse events were essentially the same in both arms of the study, both for overall side effect profile, the number of patients who had serious side effects, and you'll notice that the number of patients who discontinued treatment at the bottom of the slide due to adverse events was actually slightly higher in the control arm of the study. Importantly, number of deaths due to adverse events was identical in the 2 arms. This despite the fact a third drug had been added and despite the fact that people on the triplet combination stayed on therapy for 88 weeks compared to the control arm, which was on therapy for around 52 weeks. Another secondary objective I think is worth noting is that we measured health-related quality of life, global health status for patients participating in the trial. And as you can see here on the curves, almost immediately we started measuring this. Patients on the 3-drug combination reported a better global health status, which persisted for the full 18 months they were on Kyprolis, Revlimid, and dexamethasone. So there are 5 take-home messages here. First, the primary endpoint of time without disease progression was met, as we've already discussed, with an unprecedented median time of 26 months. Secondly, there is a trend towards an overall survival advantage, although that has not yet been confirmed. Third, the overall response rate is significantly higher, and there are 3 times as many patients in complete remission on the triplet combination versus the doublet. Fourth, despite the fact that we added a third drug and patients were on treatment significantly longer, there was really a fairly well-balanced ratio of patients who had to discontinue treatment due to side effects. It's important to note that both cardiac and renal events, which have been reported in some studies of heavily pretreated patients with Kyprolis in the past, were marginally higher in the 3-drug regimen, but overall were very consistent with, or even lower than had previously been reported. And finally, patients in the KRD Kyprolis-containing treatment regimen reported a superior health-related quality of life throughout the study. Thank you.